Okay, we'll get started here. Welcome everyone to the SADS Foundation webinar in our Living with SADS series. Tonight's topic is ARVC and heart transplants from the patient perspective. I'm Marcia Baker. I'm the program director for the SADS Foundation. So thank you for joining us. And it's my pleasure to introduce our speakers who will share their journeys with us. All have had ARVC and a heart transplant. We'll have more of their journey from them. We'll have a conversation with Nate Miller, Susan Ruhl, and Becky Sieg. So it's going to be an informal conversation, and you'll have the opportunity to ask your questions as we go along. You can just place them in the chat feature, and then we'll address those as we go through our conversation. I also want to thank one of our industry partners, Stride Bio, in supporting this SADS Foundation webinar. So thank you to Jody Wolf and Stride Bio. So first, let's start off our conversation with hearing about your heart journey. So from the time you had your first symptoms to your ARVC diagnosis to your transplant, who would like to volunteer first? Share their journey. Susan.
Sure.
Okay. Go ahead, Susan.
So my first indication that I had any heart trouble at all was when I had cardiac arrest as I was backing my car out of my driveway. I was 41 at the time, luckily survived. And that's how my heart journey started. And I spent the next 3.5 years trying to figure out why in the world that happened, because I went from what I thought was perfectly healthy to having heart failure and arrhythmia issues. And it was 3.5 years later that I did get diagnosed officially by the Johns Hopkins team. And at the same time, I was put on the heart transplant list. And while I had heart failure, I was put on the list primarily just because I had uncontrollable ventricular tachycardia. They just couldn't get it under control. And then when I went to Hopkins, they also tried to help with the VTs. Had an 8-hour ablation with Dr. Tandry, so I feel like I know him well, or he knows my heart well, I guess. And but it still wasn't able to get off of amiodarone completely. And 18 months after I was listed, I got the call to get a heart transplant, that they had a heart for me. And I'm now 3 years out.
Okay, thank you, Susan.
I
Who
can
would
go
like
next.
to share next? Nate, go ahead.
Yeah. So I was diagnosed in 2002 after having episodes of ventricular tachycardia following baseball practice. So while I was active, the first episode I had, it terminated on its own before I even got to the hospital and got chalked up to an anxiety attack. And then 2 days later, I had the same symptoms and went back to the emergency room. And that's when they found out that I was in ventricular tachycardia. I was in the hospital in the pediatric ICU. I was 15 at the time for about a week with still no diagnosis. And then about a month later, they decided to put an ICD in. So I got an ICD at that time. And when I got the ICD, they kind of gave me the diagnosis of ARVC. I went and they had me go up to the University of Minnesota. This was at the University of Iowa at the time. And I went to the University of Minnesota and met with a physician up there. They kind of confirmed the diagnosis. And then things were relatively stable for a number of years. So fast forward to 2016, and I started to have progression and worsening heart failure symptoms. Like every visit I'd have, it seemed like my ejection fraction was just getting less and less. And then finally, in 2007, March of 2017, I was listed for transplant. And in April 2017, I had my heart transplant.
Okay, thank you, Nate.
Mm-hmm.
So Becky, would you share your story for us?
I was diagnosed when I was 21. I was one of those athletes that kind of almost sort of collapsed on the tennis court. And I ended up getting shocked at the hospital. I went through a lot of misdiagnosing before that. I started being symptomatic when I was actually 12. Same as what Nate was just saying as well. They told me I had anxiety. They said maybe it's sports-induced asthma, growing pains. We heard all of that. An EKG was never done though, unfortunately. But I lived through that episode, which was great. Ended up getting shocked at the hospital, and they sent me to Johns Hopkins, which was the best possible place to go. And I was diagnosed with ARVC. Lived with that for 14 years, went through the arrhythmic aspect of it, got shocked 29 times, had 5 ablations. And then I went into right-sided heart failure. And I was told that I would have a year before I needed a transplant the day I found out I was in heart failure. And I received my transplant on Easter Sunday in 2019. So glad to be here.
That's crazy. I got my transplant Easter Sunday in 2017.
Did you
Wow.
really? Did you? I apologize to them because I was there on Easter, and they're like, "That's what we're here for." That's so
Yeah.
awesome. We have that in common.
Yeah, it's
Wow.
wild.
Yeah.
Okay, thank you. So next question, how was the recovery from your surgery? And what advice would you give to others about the recovery process?
I can
Susan,
start.
you want to go first?
Yeah, sorry.
Nate, go
I can
ahead.
start. Yeah,
Go ahead.
recovery for me was I was still active in this, and when I was first diagnosed, I think the activity restrictions portion hadn't really become a thing. I think it was just starting to become on the forefront that they were going to start restricting these patients with ARVC. So I was super active in sports, and then I stayed active. I ended up moving to Colorado, did a bunch of hiking, mountain biking, which it maybe it progressed because of that. We're not exactly sure, but I definitely stayed active. So I don't know if I compensated pretty well. But by the time I had got my transplant, I was pretty deconditioned. So I made it a pretty big deal to really work hard on the recovery process from, the external precautions, wouldn't allow us to lift weights for a while. So, but when that time hit and I was able to do cardiac rehab, I went pretty hard as I could. One of the nurses, the transplant coordinators, told me, like, you only get one chance to recover. So I really took that to heart, if you will, and spent a lot of time. I had my first child was born about 5 weeks after transplant. So that was also big motivation to get healthy and get strong again. So I've relatively had 0 issues since transplant.
Okay, thank you, Nate.
Mhm.
So Susan, would you like to share your recovery?
My recovery, I would say, was rough. And so when I was deconditioned, but I could still like walk, and I had gone on like hikes. As long as I didn't get my heart elevated, I was in fairly good shape. So I was expecting it to be easy, and it was not. So what happened was, when they put the heart in me, I'm a relatively small person, and the surgeon just told me later that it kind of gets bruised and swollen, the new heart does. And so they were not able to close me up for a week. So because of that, when I did come to, I had been basically on paralytics for a week, which that just, I didn't have much muscle mass to start with, but that just totally, I had to learn how to walk again. I had to learn how to stand. I was on a feeding tube for 3 weeks because I had been on the breathing tube for so long. I would say it was probably, looking back, it was definitely the hardest thing I've ever had to come back from or do. But part of what I'm here to do is show, even you can come from that. They had to use a sling on me to get me from the bed into a chair. And I don't know if you've ever seen one of those, but it is, it's pretty demoralizing. And my husband actually took pictures so that I can look back, and it's amazing to see how far I've come. But so I was in the hospital for a month after my transplant. And I would say it took me about 3 months before I was like, okay, that was the right thing that I did. I mean, I was really questioning because I then went immediately into rejection, and I didn't know that at the time, but signs of rejection are the exact same as heart failure. And even though I'd had heart failure before, I didn't have any of the symptoms. I never had shortness of breath. I could lay down flat, and suddenly post-transplant, when I went home after the month, I mean, every time I bent over, I started coughing, very short of breath. I mean, I felt physically horrible. And it turned out, well, I was in rejection. And so then I had to immediately go back to the hospital, which is very demoralizing after you've finally been sent home to then have to go back. And plus it was scary. But now one of the things I wanted to share is like rejection, they're just so used to dealing with it, especially early on, that it is really, it's just part of it. And the teams are so used to dealing with it that they just, they handled it immediately. And I haven't been in rejection since then, luckily. But it was definitely a rough time. And then I had physical therapy come to my house 3 times a week, which was invaluable because that's really what helped me start to walk again. Like when I first came home from the hospital, I had a walker, which was just shocking because if you had seen me going into the hospital, no one even knew that I had heart issues when I was going in for the transplant. So it was, for me, very rough, but now it is amazing what I'm able to do. Like I can jog again, I can work out, and I don't have to limit myself, which is something I really missed when I was in heart failure, because every time I worked out, I would get shocked. So that was a quick way to stop doing that. But anyway, so yes, the recovery was very rough, but it got easier and easier as time went on.
Does anyone have any advice you'd give to someone having a transplant on the horizon? Anything about the recovery process you'd like to suggest or share?
Yeah, I mean, I think that a positive attitude goes a really long way. I want to say, Susan, I'm sorry that you went through all that. You look fantastic now. But I think especially in that situation that Susan went through, strength and faith, and you've got to really believe in yourself and have a positive mindset, because that takes you very far in this situation. A really great support system is something that people don't think about a lot, but it is essential with this. And your medical team, I mean, to putting your trust in them and trusting the process.
Yeah, it's a good point, Becky, about the support system, because one of the things that I remember when going through the transplant evaluation process, it was so overwhelming with all the different specialists and doctors seeing you to clear you for all your different systems, and it's just a whirlwind of craziness. But one of the things I remember most, and the thing that I felt like if I didn't have this, it would have held me, it would have like potentially not, I wouldn't have been able to be listed or even gotten the heart, was their focus was so heavily on the support system and just making sure that there was, I had family close, that just, they were just like, that was one of their main things was, and they've obviously done it long enough that they know how important that is. And they see the patients that have the good support systems and how well they do because of that. And that was just something that really they hammered home from the beginning. And luckily I have an amazing support system and had tons of help and still do, but just wanted to reiterate what Becky had said about that. It's just super, super important.
Absolutely. And I think what Becky also said is just like, luckily I'm a highly motivated person, and I have 3 kids. So I was like, I got to get on this. And so it was like, no matter how hard it was, I would get up and go for a walk around the block with my walker and my physical therapist by my side. And it would take me 25 minutes. And it was probably, people were looking at me like, what is she doing? But you just gotta keep going. And then one of the first days home, and this is why a support system is so important, I was like, okay, I'm gonna try to help around the house. I bent over to pick something up and I fell. I mean, I didn't hurt myself, but I couldn't get up. I was that weak. Like I literally could not get up. So I luckily I had my phone with me and was able to call from my cell phone to my husband downstairs and was like, can you come and help me get up? I mean, it was just, you need a support system that then to help you physically, but also will not let you get down emotionally, because that was kind of discouraging. And that was one of the things, the great things that he did for me was when I got kind of, I was like, oh my God, it's, I break a sweat just walking across the room now. I'm like so out of shape. He showed me all the pictures they had taken in the hospital. And it was kind of in my face about how far I'd already come. Like I went from where I couldn't even stand up on my own to now I was walking around the block. I mean, I needed help, but at least, that was a huge improvement. And so the support system is really there. I mean, you need it emotionally as well as physically.
So tell me, how has your life changed since your heart transplant, or has it affected or influenced any of your life decisions?
100%. I have 2 kids, and they're 10 and 8. They were 4 and 7 when I got the transplant. So that was my ultimate focus. And pre-transplant, I wasn't able to run around with them. I couldn't chase them around the yard. I couldn't play with them. And I feel like they got half of me, and now they get their mom, their real mom. So for me, that is just the most amazing gift. I'm playing tennis again, something I never thought I would be able to do. And I have a full-time job, and I'm just loving life, and I feel very thankful every single day. So
Thank you, Becky. Nate?
Yeah, I mean, I think it definitely changed like my mentality on a lot of things, like being healthy, and then obviously like being in public again was, I think right after was kind of tough. So this was when I got transplanted, was 2017. So COVID hadn't hit yet, but I had 2 years to kind of like get used to being in public places again. And then COVID hit, and then that kind of changed everything. I'm sure we'll hear some of Susan and Becky's experience, especially getting transplanted 3 years ago, of what that meant for them. But it was like before transplant, I got to the point where I couldn't even make it up a flight of stairs. And I think I was in such bad denial at the same time that I wasn't as sick as I was, that now my transplant and recovery process, like immediate recovery process, was quite a bit smoother than what it sounds like Susan's was. But I remember the first night getting up to the chair. I think I got back from the OR like late morning, 11 a.m. or something. And by 9 o'clock, they had me up in the chair and walking by the next day. But getting up that night to the chair was easier than the night before transplant. Even with chest tubes and IVs and all that stuff. Like I just remember getting up and sitting up in bed and being like, that was so much easier than it was literally 20 years ago. And so that like right there just like sparked my motivation to get back to not having to struggle to get up a flight of stairs. And I think Becky, like, and Susan, what she talked about, like seeing how far she came, like just even seeing that was so motivating. And then having my wife and super pregnant at the time being by my side and seeing her like struggling, and just like seeing like, or just thinking like how exciting life was going to be now that I could actually do stuff. Cause I was so scared of like how I was going to be able to take care of my son and take care of this family. And it, it's just a miracle that it happened at the time that it did. And being able to hold my son on the day he was born after the lifting restrictions were lifted was, it was just like one of those things that just like one thing after another just kept lining up, and it was just obviously meant to be at that time. But I think just finding things that are super motivating, and I think everybody finds them, and not realizing that they were there, I think is one of the biggest things that I took away from it.
Okay, thank you, Nate. So Susan, how's your life changed after your transplant?
Well, I think I was also in denial about how sick I was before transplant. Like the energy, I was shocked by the energy that, and how I saw other people seeing me with that energy. Like one morning after I was home, like I was cooking an egg at the stove, and at the time, how old was he? He was probably like 13-year-old son. No, he was 12, walked in, and he was just like taken aback to see, he had been at the orthodontist. So he was coming back. My husband was bringing him back before he went to school. And he was he was like, I haven't seen you standing up and cooking. And, he was 8 when I had the cardiac arrest. So, since before then, it was just like, and I was like, well, I didn't even think about it. I was like, oh, I was just hungry and I'm going to make some breakfast. Like, it didn't even occur to me that, but it was, just this energy that I didn't fully recognize how little energy I had before, and how much I had to save myself for, just doing regular things. I remember I would go to lunch with some friends from work that I used to work with, and I would tell them, I would do one thing a day, and when I had heart failure, and so to just save my energy. And now I don't have to worry about that anymore. Like, I can do multiple things in a day and I don't get anywhere near as fatigued as I did before. So just the energy has been life-changing. I think that's the biggest change. And also, if I do start to feel tired or I need to rest, if I force myself now to go and work out or go for a brisk walk outside, it actually makes me feel better. Mm-hmm. And those were just things that weren't options when I had heart failure.
So what has been the most surprising thing about your transplant journey? Anyone?
How normal I seem. And I kind of make a joke about it. When people find out, they're like, you have a transplant? I'm like, yeah, we're actually kind of normal. That's what I say. And it always gives people kind of a chuckle. But yeah, I guess, and I know Susan and Nate can probably very much relate to this, but you're so sick for so long that you kind of feel like that's how it's always going to be. And then there's the side of it where, I remember the first time my heart beat after the transplant, and I thought to myself, wow, that's what a normal heart feels like. I couldn't get over it. And just feeling healthy and kind of normal. Trust me, there's a lot that goes into it. I don't want to say it's perfect, but you feel pretty normal, and it's amazing.
It really is amazing.
Yeah, I think one of the things that people get surprised most by is if I'm telling them the story and things, is I was on more medication before transplant than I am now. And I know everybody's story is a little different, but I think that's something that really surprises people is the follow-ups. It's I'm seeing physicians less, I'm on less medications. Other than being just hypervigilant about not getting sick, it's really a normal life. It's more normal than I was living beforehand, for sure.
Yeah, I would say if there weren't a pandemic,
yeah,
life would be amazing.
Right.
Unfortunately, this pandemic is awful for immunocompromised people.
Mm-hmm.
Yeah,
for sure.
Yeah, and I want to be really honest about that aspect of it, because I can tend to lean towards the extreme optimism side, but we do have restrictions that we have to follow, and that aspect of it can be tough. But to feel healthy is a very amazing thing. But yeah, we have restrictions as far as things we can eat and being around sick people. So my son just had, you can see him today, he's perfectly fine, but he just had 103-degree fever last night. So that's scary, because you want to be a mom and you want to take care of him, which I did. But then, I know what's most likely coming next. So we're not normal in that aspect, if that makes sense.
Oh yeah, my kid had upset stomach virus in February. And so, I put on gloves, I had a mask on, and I was taking care of him. Well, sure enough, I still got it. And he was over it in 2 days, and it took me 3 weeks. So yeah, that part is not great. But other than that, things are really good.
So if there's one thing you want to share with others facing a transplant in future, what do you want to let them know about the process?
I think, and I'm not, I wish I would have been better about this, but I think being open and honest about what you're really feeling physically and mentally. I think I held so much stuff in and held so much back and didn't really tell even the physicians, my wife, my parents, how sick I actually was feeling. I mean, by the end of it, there was no more hiding it. I mean, I got, like I said, I got pretty sick at the end, and I tried to pretend as much as I could, but it just became obvious. But you know, for so long, I just played it off. Like and part of it was I was just used to living with, you know, a sick heart, and I knew I was going to be as fast as people on the bike or as, you know, fast as people while we were hiking, but I could still do it. And I think it was just, I just would continue to tell myself, or just kind of lie to myself, that I wasn't as sick as I was. And I think I probably would have needed to get transplanted earlier than I actually did if I would have been open and honest about that. And just being able to talk to people, whether it's your family or friends, or whatever it may be, but just trying to be as open and honest you can about what's going on in your life, I think would have made things a lot less stressful for me.
Crystal made a
I
point.
100%. Oh, sorry. I 100% agree with Nate, and I think they may need to study it, and maybe part of the gene how incredibly stubborn we are. But it's like, I remember when I went before Easter for my appointment with Dr. Galatro, and she said, Becky, you don't have a choice anymore. We need to admit you. We need to start waiting for this heart. And I said to her, I'm going to wait till after Easter. And she's like, she said, if you wait till after Easter, you're not going to be here next Easter. And it was quite possible I wouldn't have been, because I got it on Easter Sunday. I got very lucky. And I would just want to reiterate everything that Nate said, because I did the same thing. I held it off as long as possible. And to be quite honest, if I held it off any longer, I may not be here speaking with you guys today. So don't be stubborn, even though it's apparently in our genes. Just try to be really honest and take care of yourself and listen to your gut.
Thank you. Crystal noted that family members might notice change before you do.
Yeah. Yeah, it wasn't that I didn't notice it or didn't know what was happening. And I'm in the medical field as well. I'm a nurse, and I work with pediatric electrophysiology, so in pediatric cardiology, basically. So I work with kids out there, and you know, I knew too much as well. So it was kind of a blessing and a curse. But yeah, so I knew what was going on, but I just, for whatever reason, just couldn't face it at the time. And I mean, it's just a lot. It's a lot to handle. And so if there's anybody out there that's feeling the same way, just know that there's other people that feel that way. And I would really recommend getting whatever sort of assistance you can, whether it's from friends or family or a therapist or whatever. But that'd be my biggest recommendation, something that I wish I would have done.
So Nettie, I'm curious that did your ARVC and heart transplant influence your decision to become a nurse?
Oh, for sure. So when I was diagnosed, I was big into golf, and my life plans were already pretty set that I was going to go to school for golf course turf management, and I wanted to be a golf course superintendent. That was what I wanted to do. And I knew that even as a sophomore in high school. And then when I got diagnosed, while in the pediatric ICU, I had one nurse that was like unbelievable. She was the most amazing. And she was my nurse for most of my stay there, like during the daytime. And she was incredible. And then I also had a nurse that was absolutely horrible. So I had like both sides of it. And I was like, I want to do what she does. I want to be like her. And specifically, I wanted to be able to like come back and take care of kids with similar things. So that's kind of what led me down this path for sure. It definitely changed what I wanted to do.
Yeah, thank you. Susan, do you have anything to add as far as suggestions or advice you'd give to others?
Well, this is more for your caretakers, and I don't know whether Becky and Nate, you had this, but I had horrible ICU delirium after the transplant, and my husband was not expecting that. No one had warned us about this, and he had experienced me post cardiac arrest, you know, when I had been in a coma for 4 days and then woke up, and that's when the doctors were like, we're not sure if she's going to wake up. And when I finally did, I had to learn how to tell time and learn how to do, all kinds of recovery just from the anoxic brain injury. So he was freaked out when he saw me with ICU delirium. And basically ICU delirium, you're crazy. I was crazy, but I didn't know I was crazy. I thought everybody else was crazy. And so I think it would have helped him a ton if he just knew that that was a normal thing and that eventually you'll come back. Like, I'm normal now, but ICU delirium is crazy. I mean, I still remember all the things that I thought then, and it's not like it was a dream. I really, I could go into detail. Part of me thinks I should write a book. It'd be like a sci-fi book if there were all the stories that I thought actually happened, but none of it really was happening. But I think that's one of the things. And then the other thing that I would say is just that every recovery is different. I went in thinking that I was going to be like Nate and being up and standing in 12 hours and that I would be home in 12 days. And I really had thought that. And so having been to stay in the hospital for a month, and it's completely unexpected. You don't know when you're going to get a transplant. So I think just knowing that that your recovery can look all different kind of ways, but you just give it time, like 3 or 4 months, and then you'll know it's worth it. Because there was definitely, I would say the first 2 months, I was like, what did I do? And I went in as a status 6, which is the lowest level. I was the first status 6 that Emory actually transplanted. So I was living at home. I didn't have severe heart failure symptoms. I had been relatively stable, but on high doses of amiodarone with the arrhythmia. So I was just assuming that then, okay, when I get the call and go in, if I'm like that, I was gonna just bounce right back. And so I think just knowing that everybody's recovery will look different, everybody's gonna run into different challenges, but in the long run, we all get to the same place. Like the recovery does happen.
Yeah, I was distinctly told by the transplant team just after transplant that it would probably take a year before I'm feeling back to like my normal self. Meds are adjusted appropriately and things like that. Because I'm sure you guys had similar things where that first like at least 6 months for sure was, every week, 2 weeks, you're adjusting your medication dosages and things like that. So.
Oh yeah, your body is just like, I remember there was one time where, I was literally shaking like this, and it was just from the Tacro. I was on way too high dose, but I didn't know that was, it's just, but yeah, it takes a long time to get the meds adjusted, to get your strength back. But just know that it gets easier and easier the further out you go.
So what else do you wish you had known before transplant?
That steroids are the devil. I didn't really tell my post-transplant story, and I won't go into it, but mine was very similar to Nate's. I was very fortunate in that aspect. But honestly, I didn't feel myself for a year. And they say that first year it tests you, and it tests you mentally, physically, emotionally. I wish I was told the impact that steroids can have on you, physically, emotionally, and mentally. Because I know it sounds bizarre, you had a heart transplant, but that was a tough aspect of it for me. But also the positive part about how you get past that first week, and then those first couple months, and then that first year, and it is so incredibly worth it. So that's the advice I guess I would give, is just knowing everything ahead of you with the good, bad, the ugly, to prepare yourself.
Okay, thank you.
Hope for the best. Hope for a really quick and easy recovery, but don't, necessarily expect it.
Yeah.
So did any of you do any kind of research in advance of your transplant to learn more information? And if so, where did you go for that?
Well, I'm a member of the heart transplant support group on Facebook, and that is a wealth of information. And you see the good and the bad, and like you do find out a lot of things on that. Somehow I missed the ICU delirium, but it's in there, and you should read some of the stories about it because they're quite amusing. I mean, now I can laugh about it. At the time, it's terrifying. But yeah, so that was very helpful. And I had been warned that I'd be waiting for a long time, so I did wait for 18 months. But I was kind of anticipating to be waiting even longer, so I didn't, reach out, or I didn't listen to things like this. Actually, at the ARVC family meeting, I did listen to that they had a panel of heart transplant patients like that. So I did go to that. But yeah, I think anything that you can read and learn is just very helpful. And then it's really about trusting and feeling comfortable with your team, because that's who you ultimately will they kind of take over, and you just have to let them take over because they know what they're doing, and you just have to trust that you're in good hands.
Thank you. Let me ask any of our participants, if you have any questions, you can put those in the chat and we can ask our panelists here.
Go ahead. Yeah, I kind of had like so I didn't have to wait very long, and that was, obviously I think it was a blessing in disguise. But like when I got listed, I had basically like the first week after I got listed, and I got transplanted before they changed the kind of the ranking system. So I was a 1B exception. So I was still at home. I wasn't on meds, and I was still working. But they told me just because of my age, my body size, they were like pretty certain that I was going to come up pretty quick. They told me like probably 6 months. But in the first, I got a call in the first week, and then they didn't say that they had one for me, but they were basically like, we almost had a match for you. And I'm like, holy cow. Then it became like pretty real, because I was like, oh, I'll get listed and then I'll have all this time, and we'll have our child, like we'll get settled, all this. And then literally, I think it was 21 days and I got the call on a Friday after work, and I was not ready. But so I didn't have a lot of time to really prepare. I could have spent some time if I wanted to, but I also was, again, in such denial that I wasn't even happy that I got listed. So it was the last thing I wanted to do. But again, with being in the healthcare field and in cardiology, I knew from that aspect. But
so Darcy asked, where is the rating system published?
I'm sure you could just look it up on Google. And if you wanted through their scholarly articles, but
yeah, it's 1 through 6, 1 being like you're like at the top of the list. 6 is you're at the bottom. It used to be 1A, 1B, and 2, but they found that there wasn't enough room to differentiate with that, and so it moved to 1 through 6. And like at the time, Emory had never. A lot of times you hear that 6s don't even get transplanted, but they do. And I was initially told that I would probably be quick because of my size, and it was mostly because of my size. And at that time, and this is one of the things that you just will learn, or I've learned through the process, was one of Emory's transplant surgeons moved right after I got listed to Vanderbilt. And so they were down a surgeon, and that actually impacts how quickly you will get the call. I didn't know that at the time. And then they eventually, they hired somebody else, but I think it took a while. And they still had transplant surgeons, so people like 1As were getting it, but they just didn't have the bandwidth to do much more at the time. And so in June, I got the call in September. In June, they hired this guy from Duke, Emory did, and he is very aggressive. The joke when I was recovering was he also does lung transplants, and that he cleared the entire list at Emory of lung transplants. And we were kind of joking, we're like, is he like Dexter? Is he like, where is he finding all these lungs? Like, how do you do that? But he was very aggressive. And when Emory got the call for me, well, with the heart that I ended up getting, they talked to him and he was like, they called because there were 2 other people on the list that they were saying that this heart was a match for. And his comment was, they, for whatever reason, couldn't get it right then, whether they were, I don't know, who knows, whether they were sick or too sick or some had an infection. But he's like, but I have another woman that it would be perfect for. So if you don't hear back from the other centers, call me back. And that's how I got my heart. And so, and kind of as Nate said, he wasn't ready for the call. I don't think anybody is ever ready for that call. I was, I mean, shocked. And I had already asked ahead of time if I could take a Valium when I got a call, when I got the call, because, you know, it's a little bit of a stressful call. And the doctor told me who I asked, he was the director of the group at Emory at the time. And he was like, you can take 2. So highly recommend getting something to help you like that. Because I mean, that made the whole, like, going to the hospital, like, I was happy as could be, waiting to get prepped for the heart on my 2 Valium.
So Lisa asked, did you have right or left heart failure? Becky answered right. Sorry.
Mine was left. And I think that's part of the reason it took so long for me to be diagnosed.
I had right failure, but at the end it led to just both ventricles were failing at that point.
Okay. Darcy asks, let's see, did you all have your surgeries in your local hospitals, or has anyone been referred out of state? I'm wondering if the rarity of ARVC makes it harder to get a transplant.
It's a good thing if you're on the East Coast as far as ARVC. I was out of state because I was so close to Hopkins. So I live in Pennsylvania, but I got my transplant done at Johns Hopkins in Maryland. So I was very fortunate in that aspect. There's a couple, I mean, I could be wrong, you guys can correct me, but I do think it's a bit easier ARVC aspect to get it done on the East Coast.
Yeah, that's a good question. I'm not sure, because I had mine done in Kansas City, Missouri, and I was living in Colorado at the time, and we were just about to move to St. Louis to be closer to my wife's family for the whole support system thing. And when we moved here, the cardiologist I was seeing, they didn't have a transplant program, so I got referred to the Kansas City program. And like I said, I got in super quick, but I feel like there wasn't like just because I had ARVC put me in a separate category than somebody else that had heart failure. I don't think that changed anything from my standpoint. And where I work currently, patients that have heart failure. They don't kind of depend. I mean, obviously, if there can be things with left-sided heart failure, patients requiring ventricular assist devices or things like that can bump people up higher in the list. But where I went and where I work, we don't really differentiate.
Yeah, I think once you're on the list, I mean, all they're looking at is your rank, your blood type, and your body size, and then antibodies. They look at antibodies. And beyond that, it's kind of like, you know, there's a whole match process. And then on top of that, you have the human interaction, you know, where, you know, people who are really aggressive about getting the heart sometimes can get it even faster.
Okay, thank you all. So Jessica notes, I had my surgery out of state. I'm 8 weeks out, live in Idaho, but am now staying in Utah for approximately 6 months to a year.
Congrats, Jessica.
Yes.
Congrats. And this is the tough part, and you're going to get through it. You're going to get to that other side. We're rooting you on.
Yes, it gets so much easier.
So thank you all for sharing your stories. Jessica, did you want to comment? I thought I saw your unmute yourself.
Aww.
Oh, thank you. All right, great.
We're
So
here for you.
I want to thank you, Becky, Nate, and Susan, for sharing your journeys. And I want to thank all the families that joined us tonight. We appreciate it. And remind you, we have one more webinar this week on Thursday evening. It's on gene therapy basics. It does start 30 minutes earlier than this one. So it starts at 7 p.m. Eastern, 4 p.m. Pacific. And Anna has put in the chat feature where you can register for that particular webinar if you haven't already. So I want to thank you all for joining us. And if our three panelists will stay on for just a minute, we'll end the webinar. So thank you, everyone, and have a good evening.